My name's Taylor and I'm the owner of Baby Buzz Tamworth, and today here I have Nurture and Nourish Lactation, Ashleigh. Do you want to introduce yourself further?
Hi, I'm Ashleigh Foy. I'm the founder of Nurture and Nourish Lactation. I am an IBCLC lactation consultant and now an endorsed midwife, providing antenatal, labour and birth and postnatal care to the Tamworth area and local surrounds.
Beautiful. But today we're here to talk to you about why we would think about going down the maternity, postnatal period and labour with you. So we're going to talk about home births, we're going to talk about private midwives. We know there's lots of information out there, and you're already going to start looking at your own information about how the impact of a midwife-based care versus private care with a doctor versus public care. I'm a new mother, I found out I'm pregnant. What do I do now? How am I going to call you? How am I going to get into contact?
Absolutely. I think that's probably the first question we need to know. So basically now, midwives can take on care straight away. So previously what would have to happen is you find out that you're pregnant and you would actually have to see your GP for a referral to get the Medicare rebate. When our midwives have that scope back in their hands, so if you find out you're pregnant, basically you can give me a call, a text message. I will then direct you to my website so I just can keep everything neat and tidy and know where all these referrals are coming through. So basically jump on the website, there is an easy contact form there. You can put your name, your due date, your email, and then I will get in contact with you and we will arrange our first little appointment, which is a meet and greet.
When we found out we're pregnant, we know how to get in contact with you, which is amazing. When you're taking clients, we're Tamworth, we're rural, we have a lot of people from everywhere. How far can we come to see? So Gunnedah, further?
Yeah, so that's been a difficult decision of mine because obviously once I announced that I was providing midwifery care, I did have an influx of not only Tamworth, but I've had Muswellbrook, I've had Scone, I've had very, very far, Corindai, Narrabri, and you name it, all our outlying towns. I've actually made the hard decision to say that I'm not going to travel more than an hour out of our Tamworth area. So I am going to be servicing Gunnedah, that's fine, and all the smallish towns within that area. There is periods if I'm okay and I've got the capacity to that we'll do Armidale, but just to start with we're going to try and start off nice and close. And look, the reason for that is because I also provide in-home postnatal care. So even if I'm at your labour and birth, I'm going to come back the next day and I'm going to come back for 3 and 4 days, so it does make it really difficult if you are more than an hour away and I've got to take that travel into consideration.
100%. And so then with that as well, do you do the prenatal appointments at home? Or?
We can do whatever works best for the mother. So perhaps she has a few other children already and she's going to find that it's a bit difficult or a bit of a daunting task to come in to see me. So absolutely I can come to home and provide those appointments. If she did live in Gunnedah and was a little far away, it would be ideal if we could have her come into the clinic, just because I can see a lot more women if I'm running the clinic rather than if I'm driving around trying to take travel. It makes it really hard. But again, that's an option. So if you're local, very happy to come and see you in your home, or for clinic appointments, that's fine. All postnatal care will be provided in your home.
In the home. Beautiful, amazing. We don't want to have birth at home or something. Do you still offer?
Yeah, absolutely. That's a really good question. So yes, so my initial package is a full spectrum care. So if you're having full spectrum care, you would have antenatal, you would have labour and birth, and you would have postnatal care, and that would be care within your home. If you're choosing to have just antenatal care or antenatal and postnatal care, we can actually just provide single appointments. That's also fine, but I also do provide the option for hospital-based support. So perhaps you want me for antenatal, postnatal and hospital support, or maybe you just want me there for hospital-based support and you've had your antenatal care perhaps with a private obstetrician. So that is also an option. The only thing I will mention though, if I do come to support you within our hospital system, I do have to step back from my clinical role. My insurance doesn't cover me and I don't actually have visiting rights at our hospital at the moment. So I come in, I guess you could say, as a doula support person. So I'm the main person there for you. I advocate for you. I know your wishes. I know your preferences. We'll certainly use all the techniques like your calm birth techniques, and you still have me as your one-on-one support person. I'm just not going to be the person providing the main clinical care. And I guess that's the same as if we transfer into hospital as well. So even if we decide we're going to do a birth at home, maybe you get throughout your labour and you decide that you would like to go into hospital, or perhaps there's some changes with you or your baby where care needs to be transferred to hospital. I come with you. I'm still your midwife. It just means that I'm going to step back from my clinical role now, and you're going to have the care of the midwife that's on shift in first week.
but then you step back as an advocate. So similar to a partner, a support
Absolutely.
person.
I'm still there for you, and I'm still there for your partner, your husband, your support person. So I'm still your voice as you need. And sometimes it's all about that continuity. And look, there's definitely circumstances where women don't feel comfortable to birth at home, and that's absolutely okay. But I can still be there. I can still support them antenatally, do all their visits postnatal after baby's born, but I'll still come with them for their labour and birth in the hospital, so they still have that known midwife with them. They just know that I'm there, just not as a clinical person.
Beautiful. So then what is the limit of patient complexity that you can have? So obviously we know quite early on twins and previous births if we've had troubles and that. So what is someone that would look like an ideal patient and then someone who wouldn't?
That's again another amazing question. So what we have to do as private midwives, we have to make sure that we're one, working within our scope of practice, and two, we also need to make sure that we're working in lines with the ACM referral and consultation guidelines. So basically we have categories. So we have category A, category B, and category C. Category A, you're all low risk, you're perfectly fine and suitable to have midwife only care. Category B doesn't mean that I can't provide your care. It also just means I need to discuss your care, obviously with your consent, perhaps with another midwife or a doctor, and just have input with somebody else. Category C means that you don't fall in my scope as a midwife, and you potentially would need to have care provided by the hospital or by an obstetrician with that. Breaks that down in terms of that. In terms of what does a woman look like for home birth, every woman's going to be unique and every circumstance is going to be different. But when we do have our initial meet and greet where we sit down and we have that half an hour of just you and me talking and discussing, we're going to go through your medical health. We're going to go through any previous pregnancies. We're going to look at your previous labour and birth. So again, that I can write down all these little things, and then we can come to that decision if you do fall under the scope of a midwife. Home birth is provided for low risk women. Again, what is low risk and what is considered low risk? But if we're looking at the ACM guidelines, these are healthy women that don't have any prior medical conditions, that have had fairly straightforward labour and births previously. So to be birthing at home, you really do need to be a healthy woman with no risk factors.
And that's free of charge as
Absolutely.
well. So
Meet and greet is there's nothing, no strings attached, completely free. We just come on in, we want to sit down together, just like I said, half an hour to go through everything. You might decide that I'm not the midwife for you, or even after our chat you might decide, well actually I would prefer an obstetrician. Exactly right. And let me also explain that after the meet and greet, I don't expect an answer on the day. So I certainly want you to go away with your partner, husband, whoever that support person might be, and have that discussion. I have you written down in my book as a potential, and I do ask that you can get back to me as soon as possible, because obviously I have a waiting list of other women. So it's either, let me know a yes or a no. I know that sometimes it can be a big decision, so I understand you might need 2, 3, 4 days.
A little bit of time.
And it's a big decision. So I obviously want you to go away, and I want you to feel comfortable with that. But then as soon as you come to that decision, let me know, so then we can go ahead and pencil you in, and I don't give that spot to somebody else. And then what we will do is we'll organise your first initial appointment depending on how many weeks pregnant you are. Very similar to if you were using the hospital system in terms of what your appointments look like. So it's every 4 weeks till 30 weeks, and then we'll go second weekly till 36 weeks, and then weekly till you have your baby. Perhaps as those later appointments, it's probably more likely me to come to your home, especially as you're getting quite pregnant. You might not want to go to other places. That's also perfectly fine. And in terms of that, we will book you in at about that 12-week mark. So we sit down, and that's where we go through everything quite in depth. But again, remembering it's continuity care. So you've got me. I can come to your home and do it. You can come to my clinic and do it. Go through that, quite thoroughly. And I guess it's something else to point out is when I talk about these ACM guidelines, you could start off as a category A, but you may over the pregnancy develop something that throws you now into a category B or C. So I guess having that understanding that there is potential for you to change during your pregnancy, but also your labour and birth, where it may fall out of my scope, where I need to involve another care provider. I think also it's really important to remember that when you pay for my services, I like to say that you're hiring a midwife. You're not hiring a birth space. The public system, you don't get to pick your doctor, you don't get to pick your midwife. It's a little bit later at 20 weeks that we go up to the hospital for our prenatal care.
and we just get chucked in a pile and someone will come and pick you off the pile.
That's exactly right.
Personal experience, that can be from 5 minutes to 4 hours.
Yes.
So that is what we're looking at here, and it's different person every day. You have to retell your story every single time. Somebody new.
So removing all of that. I am your midwife.
Exactly.
So I am your midwife from the minute you see 2 lines on a pregnancy test, 6 weeks postpartum with your baby.
Yes.
So you have me. You will have an additional midwife just for labour and birth, but you will know her. So throughout your pregnancy, there will be a stage where there will be an introduction on who your planned second midwife will be, so that you are aware of who she is. You get to meet her. You know the face. So when she does step into your birth space, it's not scary or unfamiliar.
Yeah, correct. We've got lots of familiar people.
Yeah,
we know
exactly
what's
right.
happening.
Your birth space is sacred and private, and you know what? It's an absolute honour to be invited into a birth space. So we want to limit these people. Yeah, it's going to be me and my second midwife. My second midwife will just be there for the labour and birth, after the placentas come away, and making sure that you and your baby are fine, and then usually we'll leave together.
We look at appointments, we're doing all the bits, we talk to the health provider, what's going on in our lives, we're doing blood tests and ultrasounds. Do you offer them?
Absolutely. So everything that you would expect from a private obstetrician or perhaps a hospital system, you get from me. So anything that a doctor can offer, I can also offer. I guess the thing is as well, you can see me as early as before pregnancy. I've actually had, mothers that are planning a pregnancy, and so I also offer that prenatal conception as well, if you wanted to look at what that's going to look like. But from the minute you're pregnant, we can start your appointments. It's your choice, and I respect your decision. So you may not want to take all the blood tests that are on offer or all the ultrasounds that are on offer. I can provide them, but again, it's up to what you would like, and I respect that decision making. You might want to have your non-invasive prenatal testing, so your NIPT as well. Again, that's a choice. If you need that, I can absolutely refer you for that as well.
Amazing. Now the next question is there any out-of-pocket cost? We, in a public system, we know we don't pay for that, but then we do pay in other aspects, in time.
Yes.
We don't get consistency. So obviously you're a private practitioner, there is a private fee.
Try to make it as easy as possible. So for your full spectrum care, there is a big fee, but in terms of that, we also break it down as well. So like I said, initial meet and greet, completely free of charge. No money will change hands till your booking in appointment, where you will pay a non-refundable deposit. Then after that, you can pay it off. So you've got till 36 weeks to have the rest of the bill settled. In terms of what you get back in your rebates, you get about a quarter back for your antenatal and postnatal care from Medicare, and you'll do that at the end of our care. So basically at 6 weeks and 6 days, I'll sign you off and we will finish off our care. I will provide you with an itemised receipt, which you can jump on the MyGov app, and you can then just lodge all the item numbers and you'll be reimbursed. Usually it's about $1,500 to $1,900 for antenatal postnatal. We are hoping in the near future that we'll see labour and birth covered by Medicare, because now we've just recently got intrapartum insurance as of the 1st of July. So we're hoping Medicare is going to come on board and that you'll be able to get an additional rebate. We've also got private health insurance cover. So I am a recognised provider with many of the health insurance providers. So it would again be depending on your provider and what level of cover you got. You may be able to claim an additional rebate.
Fully booked out for the next few months, which is amazing. Do you limit your client base? Obviously you do, because you've now said no more for these people. So why are you doing that, and why is that a good thing?
Because it's about that continuity of care, and you're having me as your midwife. I don't want to take on too many women where I'm too far stretched. And at this stage, I am the only private practicing midwife, which means I am the only one that's endorsed. So if I can't provide your care, unfortunately, I don't have a backup in terms of another primary midwife that can step in. I do hope in the near future that my second midwives will become endorsed.
So let's break that down a little bit for a second as well. What is the difference between a midwife and an endorsed midwife? So when we go to the hospital, we're seeing just normal midwives. When we go to a private practice, there are midwives there, but they are still only midwives. What is the difference in role? Because your other midwives are only midwives as well.
Yeah, that's right. So I've had to do an additional university degree in pharmacology and diagnostics and screening. So I I have the authority to prescribe any medications that a doctor can prescribe, and I also have the authority to request blood work and ultrasounds or any scans that need to be done. I've had to have 5,000 clinical hours over the past 6 years, and then I have to put that all through APRA, and the board have to sit and say that I meet the standards of practice to gain my endorsement.
Okay, beautiful. And so that's just like a further education to make sure that we're meeting all the requirements for a safe, sound birth, really.
That's exactly right.
If something was to happen through the pregnancy and my care needed to be transferred, or like you said before, we're teetering onto the B, category B, who are you talking to? You said you did have to talk to another midwife, another doctor.
Yep, so under the guidelines, if you're all falling into that category B, it could just be me discussing the case with another midwife, again with your consent that you're happy for me to speak about your circumstances, or it could be another provider. Perhaps you developed blood pressure issues throughout the pregnancy.
Something
different, or perhaps something came back on one of your scans that Bubby had something a little bit out of what we consider normal. So it could be me needing to speak to a pediatrician about Bubby, or it could be me needing to speak to an obstetrician about your blood pressure. And look, we have things called ROUs, which are records of understanding. So if there's anything that would fall out of the normal, I guess, for our guidelines, I give you all the information and the research behind it, and if you still decline, it could be something as simple as a GBS swab. Perhaps you've had previous GBS or GBS in your urine, and I had recommended you to have a swab, but you said, no, I don't want to have that swab. That's perfectly fine. If I had thought that it was necessary and I was recommending it, I would just fill out these templates saying, I've given you all the information, all the advice, all the literature, you're well informed, you're well educated, and you've still decided against that, and then we both just sign it. So that just covers me as well, as understanding that if we do transfer into hospital, that you chose not to do that and you respectfully declined.
Beautiful. So then reaching out with that a bit further, say that was to happen, something was to change in our care, you'd be talking to the public hospital, or you could talk to both the private
absolutely
here?
Yeah, we could discuss it with either. So if I needed to just speak to someone quickly, it might just be one of the obstetric registrars that are on shift in birth suite. It could even just be a midwife in birth suite that I needed to run something by, or perhaps it is one of the private obstetricians if they had capacity through the day to take a phone call from me and I needed to discuss a case with them. I think it's also important to put across that we do have strict transfer plans in place.
Okay, beautiful.
So if you do need to transfer to hospital, we should have everything sorted that is a very easy transfer. So I do recommend that you book into our local hospital, just like you would book in normally. And here is, if we're doing a labour and birth at home, I'm going to pick up the phone, I'm going to call birth suite, and I'm going to be like, just letting you know that we're going ahead with a labour and birth. This is the woman's name. Did you want to grab her file? So then they can have a flick through, have a file ready there. Perhaps something changed, or like we said before, you changed your decision and you said, look, I really want to go to hospital. I don't feel comfortable anymore at home. That's okay, we can do that. I'd give a call back to birth suite saying, just letting you know that we're transferring in. This is the reason why. This is what we've done, and they will be ready to expect you and have all your recent, full blood count, knowing all your statuses of your serology and ultrasounds as well. So that's recommended that we do have the women book into the local hospital. And with that transfer plan, we have a sheet of paper that's filled out with your home address, how close is the nearest hospital, what's your nearest cross street, and these are all the questions that an ambulance is going to ask. So perhaps something went a little different in your labour and birth where I had concerns for you or your baby, and I recommended that we transfer into hospital because we needed to provide additional clinical care. The sheet's designed that if anyone in the home can make that call, so my second midwife or perhaps your husband, if I needed to be with you, can make that phone call to request ambulance support.
And that's another question, I guess, in a way, is that does your paperwork, so every time we meet, I'm sure you're taking notes and doing
Absolutely. So my paperwork is going to be slightly different to the hospital, because at the hospital at the moment we're still paper based, where for me that just wasn't going to be practical. So I've actually got all my paperwork online. So it's all on my computer. So everything I do is online. I can do it off my phone, an iPad or a computer. I do have some handheld records if need be, we can absolutely do that. But what that would look like is when I'm at your labour and birth, either myself or my second midwife, when we obviously have a minute during the labour, would be still jotting down everything on the computer. And I mean, we use the computer in labour and birth suite. And then what would happen is, if I transfer in, I'll just jump on one of the birth suite computers, or I can email it, and we'll just print off all your records. So then we have a handheld document as well, so that they can see everything that I've had.
The hospital, I think, in a way to explain it, is that you, the hospital, when you go to the hospital, they do paper for everything, but it does get uploaded to the computer.
Yes, that's right.
Afterwards.
So basically we're triple recording when we are working in hospital.
So you're just skipping the paper and going straight to the computer.
The only thing that is the same as what you have in the hospital is that you have, you know what we have as a yellow card?
Yes.
Well, I have a white card.
But
it's exactly the same. It's an antenatal record, but I've made the decision to make them white so that it can be recognised that you are having care outside of the public system.
So that's amazing. So we still have a little card that we go, this is my little story.
Well, you actually get a cute little bag. So basically when you choose to have me as your provider, you get this really adorable little bag with my logo in it, and it will keep your antenatal card. It's going to keep all your bloods or ultrasound request forms. I've tried to make it really easy. Nice little setup that you can just drop into your handbag. I will add, if you're choosing to home birth, you also get a home birth package as well from Homebirth New South Wales. You get free membership to Homebirth New South Wales as well. That's all been covered as me as the provider as well. So you get a little package of samples and things like that. And like I said, you've got this membership so that you've got a community behind you as well. So that's a nice little extra as well.
It's the middle of the night, something has gone wrong, or I just need to be checked out. So we know that we can go straight up to the hospital because we're pre-booked. They know about us. We have
look, I would be your first port of call. So remembering that I'm a 24/7 service, if you're choosing to home birth with me, concerning you enough that you're worried, absolutely. You've got my phone number. You can shoot me a text, or you can shoot me a phone call, and if need be, I can come and see you. So that's going to again take off that stress of the birth suite staff, but also having you sitting in birth suite for hours upon hours. It could be just something very minor that I can actually deal with and not send you to birth suite. If you were really concerned, or maybe I wasn't available, absolutely, you can give birth suite a call, or you can make a presentation. That's always going to be available to you, but if need be, I would always be your first point of call.
Okay, interesting. So 24-hour care then. And so, like, for an example, is something like, okay, I have fallen over, and we know that we have to present when we fall over while pregnant. We would probably call you up first and talk to you.
I still want to know, absolutely. So even if it's just a text message, I would like, letting you know, Ashleigh, I've had a fall, I'm heading to birth suite, or perhaps you just want to run something by me and you weren't sure of what the process is. So you've rung me and you said, I've just fallen over the cat. Oh my gosh, I'm not sure.
I'm okay, but what do you want me to do?
But see, look, if we're following the standard policy for that, I would still have you present to birth suite because we do want to do a CTG.
Appointments have been great. We've had some hiccups. We've sorted them out. We are now moving to birth. We're giving birth now. So what's this going to look like? Are we still doing home birth an hour out of town?
Yes. I am happy to home birth at Gunnedah, depending on circumstances as well, because we do need to take into consideration our transfer hospital would be Gunnedah. Gunnedah often are on bypass, meaning that the women are actually sent through to Tamworth. So we do need to take these things into consideration. I guess it would be looking at the woman's circumstances and what category she's fallen under, and making sure that she really is quite low risk if we are out of town. What's my comfortability with the situation as well?
So someone on a farm out of town, are we still happy?
Look, as long as you're within that 1 hour, I'm happy. If everything is all low key, my second midwife's happy, we still have that transfer plan in place. We just have to have that, I guess, in the back of our mind that if we do transfer, that we've got to transfer a lot more earlier.
What is the home birth space looking like? Like, I've got dogs running around.
Absolutely. You know what? Children, pets, animals, who you invite into your space is up to you, You're paying for a private midwife, you're not paying for the space. So I bring everything that you should need. I will give you a little list of a few additional things, like maybe a couple of bowls, maybe a couple of towels, but it's what makes you comfortable. In terms of when you pay for your full spectrum care, you get everything in terms of, you got my beautiful white birth pool, you get the liner, you get the pump, you get fairy lights, you get affirmations, I've got TENS machines, I've got Rebozo, I have got birth cones, homes. So that's all included. You also have full access to my borrowing library.
Yeah.
So whether that be my books, I've got beautiful home birth books to read to your other children so that they understand what this home birth process might look like. So that's all included. You can borrow whatever you like. I've got birth map books. I've got how to sit down and plan out what you would like your labour and birth and what questions to ask other healthcare providers should they be involved. Usually at about that 37-week mark, I'm going to turn up to your house with that birth pool and you're going to have that there ready to go. And I will go through how to set it up and what we need in terms of like hoses and attachments. If you're on carpeted area, I'd usually recommend just maybe a tub or something just because we don't want wet footprint or to disturb any new carpet, but you don't have to go crazy. We would like to keep the environment space nice and warm and dimly lit as well. So just trying to think in the back of your mind where a nice space is. Perhaps there's a spare room that we can clear out and put some affirmations up and birth lights and things like that to really make it that safe, private, calm environment for you. Also at that 37-week mark, I'm coming to your house with a little container which has some medication in it. It's just got some syntocin, which is artificial oxytocin. Likely we're not going to need it, but it's a medication that needs to be kept in the fridge. And the reason I'm coming to pop that in your fridge is that if I'm out and about or doing another home visit and you give me the call and you say, good to go, I think we're going into birth, that I might not have the opportunity to duck home to my house to grab it. So at least I can be reassured that you've got medication in your fridge that if we need it, it's right there. Look, and when I say the syntocin medication, these are the medications that we use if you're bleeding a little bit too much for my liking. So again, like medications that you have in hospital, I've also got with me. So I'm bringing all my bags with all of my stuff. But there's not too much that you need to supply. I'll give you a piece of paper with a few things. Again, it's what makes you and your space comfortable and whatever you need to have that beautiful birth.
And then do you need any space? So like obviously you've taken this little tiny space in the fridge. We've got a birth pool set up or nearly set up, ready to go, but you don't need a certain room.
No, absolutely not. I'm literally in the shadows. I'm there when you need me, and that is it. I will be sitting in the corner in a pair of trackies,
cheering from the sidelines,
observing you. I'm really coming in to you when you invite me in.
You are that safety net. That's what you are being there. Where in the hospital we are very guided by policies and guidelines.
Look, it's about giving women back their choices. You're the expert when it comes to you and your baby. And women that are home birthing, they're very well educated, rounded women. They know that home birthing is going to provide them with less intervention than what we're going to see in the hospital system. And if they're low risk, healthy women, honestly, they are perfectly safe to be birthing at home.
So your equipment is covered in the whole entire program, which is amazing.
Everything that you have access to in hospital, I think I've got. I come with oxygen. I come with resus equipment for both mother and for baby. I come with a Doppler to listen to your baby's heartbeat. I come with all the tools that we have in a birth suite as well. So anything that you would normally have in your birth suite, I'm bringing along.
So then when we look at the home birth, and you've already said that you've got the medications, but let's go a little bit further. And we've gone, okay, this is too much for us. Maybe I need the epidural. Maybe I need something further. They do offer some certain pain reliefs. Do you offer all, or do we start to look at like...
So when we're home birthing, we're going to be looking at the non-pharmacological pain relief. And when I say non-pharmacological, these are things that are not using any medication. So that's going to be, we're going to use calm birthing techniques or hypnobirthing. We're going to be using things like our birth comb, our TENS machine. We're going to use water immersion. We're going to use our rebozo, positioning and massage, acupressure, using the points. We're going to use all of that. If we use all of that and you still say, Ashleigh, I can't take this anymore, I just don't want to do this anymore, then we would have to transfer to hospital. So if you do require further pain relief, such as a morphine injection or an epidural, we would move into hospital. I can provide sterile water injection. Women will hire nitrous oxide. It is, I believe, quite pricey. I haven't looked at it myself and I'm not quite sure what the process is going to look like. Something that I'm happy to explore, but that's usually on the woman's half and usually something that they would organise themselves.
Now, in the instance that we didn't progress and maybe we are quite far along in our pregnancy or something's happened and we need to be induced, what would that look like?
Look, if we've tried everything in terms of natural induction methods, again, we have a process. So we do know that pregnancies can go up to 42 weeks.
And well past.
Yes. Yeah. And so I would again just offer you my recommendations. That could be a daily appointment with me checking in that everything's okay. It could be you presenting to birth suite and having daily CTGs. It could be you having an ultrasound every couple of days, just to make sure that the placenta's still doing its job and the blood flow and all of that is working. But again, you have the right to decline. If we do need to look for a medical induction, perhaps we got to 42 weeks and your baby still wasn't coming, or maybe we even got to that 41-week path and you did start developing a high blood pressure, or maybe your baby's movements weren't as what's normal for you, and we were thinking in collaboration with a doctor that it's probably an idea to look at bringing your labour and birth on. An induction would be planned within the hospital setting as well, but absolutely you've still got me as your midwife. I will still be coming along for that induction, and I still would be present for your labour and birth.
Okay, so our waters have just broke. What are we doing now? Are we calling you? And
Yeah,
going,
absolutely.
oh, it's only a little tingle here. It's not even that far along. What are we going to do?
You can let me know at any stage. You might just ring me in the morning and give me a little heads up that you've been having some little contractions overnight. That's perfectly fine. I might go about my day and come around my clinic or whatnot, and you just keep me updated throughout the day of how things are progressing. Obviously, if your waters break, that might mean things are a little bit more along, and I will be asking all the questions of please put a pad on, what's the colour, consistency, what's the smell. There's absolutely nothing, and you've literally just broken your waters, so be it. We'll wait to labour to start and kick on. Usually labour will start in the next 24 hours as well, but I will absolutely come and see you, and maybe you just need some reassurance. Usually you'll find that labour will start to progress as that nighttime period comes on.
And then so you will be giving us like regular calls and updates going, okay, how are we progressing? What point are you going to come into the birth space?
Whenever you need me. Look, it's ideal to try and keep you doing your thing without me for as long as possible, and the reason behind that is that we don't know how long your labour and birth is, and I also need to be able to function. So there's no point me sitting there while you're in a very early latent phase for hours upon hours, because then when it does come to your labour and birth, I'm going to be exhausted, and there's no point for that. Once I come into the home, if labour's really labour, I would hang around. She might not need me directly there, like I said before. I might be able to sit back and just kind of be that observant, but if we're actually in labour, I wouldn't leave if that's the stage. I mean, it's important to remember that the latent phase can be a hit and miss. It can be something that women can experience for a long period of time, so you really don't want me there till you're in active labour, and that's really that 3 to 4 contractions in 10-minute period as well, because they're what we're looking for to create that cervical change. And I guess this could be quite relevant to first time mothers where they don't know what to expect and they haven't laboured before. So look, of course there's going to be a bit of anxiety there, and they might need me a little bit earlier than perhaps a mum that's had 3 or 4 children. So that's fine. Again, it's going to be tailoring to your needs, what your circumstances are.
So great, we've given birth, we have our beautiful baby, we're in the golden hour still, we're doing all the wonderful
Undisturbed
things.
golden hour.
So what happens after that? How long are you staying? Is there any certain things that you need to tick off?
Nope. So the first 1 to 2 hours is all about you and your baby, and again creating that womb-like environment. So you know what's happening. I'm tucking you up in bed with a cup of tea and a baby to the breast. That's what I'm doing. I'm then in that background, obviously doing a few little notes here and there, but I'm cleaning up. This is my job. You don't need to worry about any of that. So what I'm doing is I'm emptying the birth pool, I'm packing up the birth pool, maybe my second midwife's doing a little bit of note work behind the scenes, but I'm cleaning up that space and area. I'm usually there for about 6 hours after your birth. But again, tailoring it to what you need. I need to make sure that you and your baby are comfortable, happy and safe before I go, but also know I'm back first thing tomorrow. So if you have any worries or concerns overnight, maybe you started trickling a bit of a blood loss and you weren't too sure, of course you can check in with me as well.
And then what does postnatal care look like? So what are we doing after? You've stayed, you've come back. The first day.
I'm back the next day. I'm back every day to about day 3 or 4, again depending on what your needs are. Coming back at day 7, coming back at 2 weeks, coming back at 4 weeks, and then coming back for our final visit at 6 weeks as well. But again, having that understanding, if you need me more often than that, that's also perfectly fine. I'm just doing all the normal stuff that you would have done within the hospital. So all your baby's weights and lengths and measurements. If you're choosing to vaccinate, I can't provide Hep B vaccinations just because of the cold chain and trying to have a fridge. So that's something you would need to see your GP for. But we can certainly do vitamin K if you would like to do that orally or via IM injection. We can certainly do that. If you're going to have the hearing test, which all our babies are recommended to have, you would just need to pop up to the hospital, and I will organise that with our beautiful hearing coordinator that you can do that. But otherwise, everything else will be done in your.
So then, Ashleigh, you are this amazing, beautiful continuity of care private midwife. But you also do so much more.
Yes.
So you also do prenatal group classes. And we're going to talk about that, what that involves. But briefly in front of that, I want to say that and many women are going to do this research. We know you're going to do this research, but there is such big benefits in private prenatal care. There's actually studies that show that women get better birth and labour scenarios when they look for education outside of the hospital. The hospital is guidelined by policies, procedures, and is often hospital based.
Correct.
So when we look at a private prenatal care, we're looking outside, we're looking at the whole picture. So what does that look like?
So for me, education is a really big thing. And if that's one thing that you could afford and you couldn't afford anything else, and you asked me what I needed, I would want you to have education. And look, we know that those studies prove that. Education in the antenatal period for preparation for labour and birth and for preparation of breastfeeding, the studies show us that we go in having successful birthing experiences and successful breastfeeding experiences. So knowledge really is power, and it's so very important. You need to know what normal, natural labour and birth is. You also need to know how to advocate for yourself and how to ask questions. So if you were to attend one of my calm birth courses, I give you all of that. So calm birth is a full weekend. It's 12 hours of full packed labour and birth preparation where we're actually utilising the mind and body connection. So I teach you to pull out all those tools that you already have and how to bring them to the top of that service so that we can build this toolkit to take into your labour and birth. So how you know to work that mind with your body, you can overcome any type of concerns in terms of your labour pains, and you just progress through labour so much better once you know what's normal and what's not normal as well. And being able to ask questions. So when intervention is offered to you, having that understanding of, do I really need to have this intervention? Do we have time? Do we need to do it right now? What are my options? It's really about learning what to ask and what you have the ability to say no to as well, because remember, this is you and your baby. And I always try and get across what you experience, your baby also experiences. So calm birth classes, fantastic. These are the best antenatal classes in my opinion that you can attend. Look, 12 hours of education from start to finish. It is literally whole preparation for labour, birth, postnatal period where we go through absolutely everything from labour and birth to the first few weeks postnatally. I also then, in addition, provide breastfeeding classes as well, where we're going to go quite in depth. It's a 3-hour course of breastfeeding and postnatal newborn care. So that's another option as well. I also do offer private classes. So if you're not comfortable being in a group setting, or perhaps my dates just don't align with your dates and your husband's or partner's or support person's dates, I can either provide a private calm birth class or breastfeeding class here in my clinic, or I can actually come to your home and provide that class to you as well. All my classes, you're provided with a little goodie bag and a voucher of my postnatal services, and morning tea is always provided in my classes as well.
Beautiful. For partners as well. I think it's a really big thing for partners to be involved.
That's such a big thing, honestly. Calm birth is all about how your partner can support you in labour and birth and in that breastfeeding and postnatal period as well. We're giving them the skills as well. Usually they've got the tools down there inside, but they're just not quite sure how to utilize them. And honestly, that's the best feedback I've had from my calm birth couples is that their partners felt really happy and supported, that they felt that they could really support their labouring partner in such a great way.
100%. Now, your phone is just vibrating and your computer turned on. I was like,
it's all good. It's just
phone call or something. Okay, cool. I was like, I don't know. Okay, beautiful. So just to make you do private prenatal classes different to your Homebirth, or are they all together?
So I've gone ahead and I've changed. So previously I was offering bump to breast, which was a bit of labour and birth and a bit of breastfeeding as well. It tended to get a little bit confusing in terms of the labour and birth stuff because it was very brief and it was very touched on, and I found that there were so many more questions. So I've actually decided to separate both these classes. So bump to breast now is just breastfeeding and just newborn infant care, and Homebirth is just antenatal classes, just so that it's easy and I can give women what they truly need. I thought that I could touch on a little of labour and birth. We can't just touch on a little labour and birth. There's too much to cover in 3 hours, and honestly, 3 hours covers just breastfeeding. So if we're doing full antenatal classes, we're doing the 2 days of Homebirth. I will add on though, I'm also offering a Homebirth cesarean course. So if you have had a previous cesarean section, or you know that you're going to have a cesarean section for your birth, I do offer a 1-day Homebirth cesarean course. We're still able to use our mind and body and use our breath, but we're just going to take out all of the labour and birth stuff, and we're going to focus on a cesarean section, and we go through from start to finish what cesarean section looks like, and again to ask what questions are needed and what your recovery and how your support person can best support you as well with this type of birth.
That is absolutely amazing. You do also offer lactation services and consultation after that.
I am an IBCLC lactation consultant as well, so I'm recognised internationally as having done a lot of extra lactation. Again, another university degree that I've added on, specific in lactation education. If you are having me for your antenatal and your Homebirth and your postnatal care, of course you're not going to be paying any additional fee to have me as your lactation consultant. Absolutely, I'm going to be supporting you with your lactation and your breastfeeding education on site and helping you to breastfeed in the best way that I possibly can. If you do need additional or more in-depth lactation support, then you would come and see me as a lactation consultant. I can either come to your home or you can come to my clinic. But again, now because I've got my endorsement, you're also going to get Medicare rebates for lactation services as well as your healthcare provider should you have coverage for that as well.
And then we can also see you without even seeing you for prenatal, labour, birth. You've been doing this for a little while.
For the past 2 years, I've been operating as just a lactation consultant. So my clinics have been literally just lactation as well as the NDC gentle sleep stuff as well. So that's very happy. Again, it's a self-referral, so you can just jump onto my website and you can go ahead and book for lactation services. You can also book one-on-one antenatal education as well. All my antenatal education that we have one-on-one includes a antenatal expressing kit that you get to take away and full preparation of breastfeeding.
The last one is a gentle sleep consultant. So what is that? Gosh, sleep training is a big thing at the moment.
I know, right? Look, I'm so sorry if you are asleep training or wanting that type of sleep. I am not the person for you, and I'm going to undo everything that you've ever learned about sleep. So I follow the NDC, which is neurodevelopment care, or the POSSUMS approach, and it is all about responsive parenting. So it's all about ensuring that you and your baby sleep, breastfeeding, it all goes hand in hand and it all works together. So we're all about responding to your baby and creating that safe and nurturing environment. There is absolutely no rigid schedules. That's out the window. And there's absolutely no cried out. That's out the window.
No eating butter at 8 o'clock.
No.
Out the window.
Absolutely not. So it's all about working with you and your baby, and also understanding that you are both unique and taking that into consideration. So a gentle sleep consult with me is so different to what any other mother, I'm sure, that's gone down that sleep training path is recognised, because everything they're doing, I tell them, is right. Because if you're co-sleeping, breastfeeding and getting up to your baby throughout the night, this is all biologically normal, and I guess that's what's so important to reiterate to parents. And look, sleep deprivation is an absolute killer, and wanting to explain that our babies are biologically wired to wake up well into toddlerhood. This is a normal function. This prevents, protection against SIDS, which is our sudden infant death syndrome. But also, we're the only society that expects our babies to pop out of our uterus and go and sleep by themselves in a lonely, darkened room. That's not how it is. We've got to look at all these other beautiful communities, Alaska, and places where once they have their baby, these babies are skin to skin and carried with them, and they go to work and they sleep on their back. They're never separated from the mother. So we really need to bring that back to basics.
My absolute favorite saying is that there's actually a study in Japan that shows that they eliminated all the risk factors of co-sleeping. Everyone got taught how to co-sleep safely.
That's exactly right.
And the SIDS risk is zero.
I'm all about fear mongering, and look, sometimes parents don't want to know about co-sleep, and that's okay. Again, it's a really personal choice, and if you're not comfortable, or your partner, support person, whoever's in your life is not comfortable, that's perfectly okay. But we actually know from the research that up to 80% of families will co-sleep, whether that's intentionally or non-intentionally. So I think it's more important to give that education about, if you are intending to co-sleep, how can you make this safe, and knowing that if you're in a safe sleeping scenario, perhaps sitting on a chair like this and you're drifting off to sleep, knowing that this is not safe and that you need to get up and take yourself to a safe sleeping environment. There's a checklist. The SIDS website does have a checklist for safe co-sleeping, and we go through all that. And once we go through that, the look on mothers' faces and the reassurance, it's just that relief of knowing, I'm breastfeeding my baby to sleep and that's okay. Yes, it's okay. My baby cries and needs to be cuddled. That's okay. This is all very, very normal. So we're just taking it back to really being a responsive parent, and we're really also focusing on the mother's mental health and just doing the best so that we can really function. We just want to make your nights and days more enjoyable so that you can have a beautiful relationship with your baby. So less focusing on times of going to sleep and comparing. Please don't compare. Like, you can't compare, because honestly, babies that sleep through the night, they've got a unicorn, because it's actually not normal, and babies wake for a reason. They do need to be fed throughout the night. So again, just telling parents that this is so very normal. So if they do need any help with sleep and settling, and what can we put into place to just make these changes quick and easy and make everyone's life more enjoyable, that's just another service that goes hand in hand with my lactation.
So I think that is all the questions I have today. We've got this beautiful new midwife in town, which seems a bit scary to people, but it's not something that's new. It's in Sydney, in Newcastle. It's your standard, and
I'm just bringing it to rural Tamworth.
That's
exactly it. This is continuity of care, and this is what women who are low-risk healthy women, they don't need to be birthing in a hospital. Leave hospitals for the more medicalised birth. And we know we need hospitals. We know we need doctors. We're not trying to get rid of that. We're just understanding that there is a space at home for healthy low-risk women to birth.
That's right. Beautiful. And then we have continuity care all the way up until after birth. And then you have all these other wonderful services.
That's it.
So
we don't have to stop. I mean, when we say 6 weeks and 6 days, that's because that's where Medicare stops.
That's right.
So it doesn't mean that you can't stop seeing me. We would just fall under a lactation consult or a sleep and settling or something else. It just wouldn't be that antenatal, postnatal type of care. We're just going to come under something else then. It just means you're not getting a Medicare rebate for whatever that might be. But if it's a lactation support, then it's going to change over and you'll get rebates for that.
Amazing.
Trying to make it more accessible.
What else can be?
I'm here.
I love it. So thank you so much for talking with me today.
I love that I've been able to share who I am, what I'm about, and what these new services are that we can provide to our Tamworth community.
Thank you so much.
Thank you.